So now let's talk about sedative hypnotics. Sedatives are drugs that have a calming and quietening effect on the body and reduce the excitement, whereas hypnotics are drugs that induce sleep resembling natural sleep. Now, although they're both CNS depressants, they differ in the time action and dose action relationship. Drugs which have a longer duration of action and act more slowly with a flatter dose response curve are preferred as sedatives, whereas drugs with a fast onset of action and fast metabolism, shorter duration, and steeper dose response curve are preferred as hypnotics. This is the classification of sedative hypnotics, which includes benzodiazepines, barbiturates, and miscellaneous agents. Coming to barbiturates. Now, GABA is the principal inhibitory neurotransmitter of the central nervous system, which acts on GABA receptors. GABA A receptors are ligand gated ion channels which have 5 pentameric subunits. What barbiturates do is they bind to the beta subunit of GABA A receptor, chloride channel complex, and increase the duration of GABA gated channel opening. So, Barbies last long, so they increase the duration of GABA gated channel opening. And at larger doses, they directly activate the chloride channel. So, by increasing the duration of GABA gated channel opening, they increase the flow of chloride ions into the neurons, thereby hyperpolarizing the neural membrane. This facilitates inhibitory neurotransmission by hyperpolarization of the neural membrane by increasing the duration of the GABA-gated channel opening. The pharmacokinetics of barbiturates. Now, they're lipid-soluble drugs which are well redistributed in the body. So, an example being thiopentone, which is an ultra short acting barbiturate. It is highly lipid soluble with a fast onset of action, and it's fast metabolized because of redistribution throughout the entire body. They are metabolized in the liver to inactive metabolites and excreted in the urine. They are hepatic microsomal enzyme inducers, which is why their dosage must be carefully monitored in patients on different drugs, such as or they might increase the metabolism of oral contraceptives, which may lead to unplanned pregnancies. Alkalization increases excretion because they are acidic in nature. So this property might be used in barbiturate poisoning. Coming to the classification of barbiturates, there are long-acting such as phenobarbital, intermediate such as amylobarbital, short-acting such as pentobarbital, and ultra-short such as thiopentone and methotrexate. Pharmacological actions. On the CNS in a dose-dependent manner, barbiturates have a sedative, hypnotic, anesthetic, and anticonvulsant effect in a dose-dependent fashion. At an even higher dose, they cause coma and death. On the respiratory system, they have a depressant effect. They suppress the chemoreceptor response to carbon dioxide, and large doses lead to respiratory depression and death. At the CVS, in normal doses, at low doses, they have insignificant effects, but at larger doses, they cause circulatory collapse due to medullary vasomotor depression. At the skeletal muscle, they reduce muscle contraction by depressing excitability of the neuromuscular junction. So they depress the excitability of the neuromuscular junction and thereby reduce muscle contraction. The uses. Now, first off, they're used in sedation and hypnosis. In patients suffering from insomnia, barbiturates were earlier used for sedation and hypnosis, but due to their ability to cause tolerance and dependence, they're not preferred anymore. General anesthetics, ultra short acting barbiturates such as thiopentone and methotrexate are used in the induction of general anesthetics. Anticonvulsant. Phenobarbital has anticonvulsant effect and is used in the treatment of status epilepticus and grand mal epilepsy. Neonatal jaundice. Because they are microsomal enzyme induces, they increase the metabolism of bilirubin in neonatal jaundice. Diagnostic aid in psychiatry. Now, in sub-anesthetic dose, thiopentone produces a deep state of sedation. The patient becomes more communicative, which helps in diagnosis of psychiatric conditions, underlying psychiatric conditions such as hysteria. Adverse effects. Primarily being hangover, there is residual CNS depression associated with nausea, vomiting, vertigo, diarrhea, mood distortion, impaired judgment, and fine motor skills even after administration of the barbiturate. There is respiratory depression, and they're contraindicated in porphyriasis, where there is an increased buildup of porphyrins in the body. They have an ability to cause tolerance and dependence and require a higher dose. Coming to benzodiazepines. Now, benzodiazepines bind to regulatory sites on receptor and increase the frequency of chloride channel opening, thereby increasing the flow of chloride ions into the neurons, leading to hyperpolarization and depress the synaptic transmission. So they act like barbiturates, they act on the GABA A receptors, which mediates the fast inhibitory synaptic response, but they enhance the effect of GABA by increasing the frequency of the chloride channel opening. There is no change in the mean open time or no change in the conductance. There's no change in the duration of action of the opening of the channels. There is change in the frequency of chloride channel opening. Pharmacokinetics. They are rapidly absorbed by oral route. They're lipid soluble as well, redistributed from the CNS to muscles and adipose tissue. They're highly plasma protein bound, and they're metabolized in the liver in two phases. In the first phase, there's an active metabolite which is formed, and in the phase 2, they're excreted in the urine by glucuronide conjugation. This is the classification of benzodiazepines. There are long-acting drugs such as diazepam and flurazepam, short-acting such as lorazepam and alprazolam, and ultra-short-acting such as midazolam. Now coming to the pharmacological actions. Sedation and hypnosis. So these benzodiazepines are preferred drug for short-term insomnia as in comparison to barbiturates because of the fact that they have a wide therapeutic index and they cause a near normal sleep with minimal REM suppression and less rapid eye movement rebound on withdrawal. Unlike barbiturates, which disrupt the normal sleep cycle. They have minimal hangover effects and minimal respiratory depression. They're less likely to cause tolerance and dependence, and they have no enzyme-inducing property. There is also an availability of a benzodiazepine receptor antagonist, which is Flumazenil, which can be used in the treatment of overdosage. Apart from that, the uses being insomnia due to sedation, anxiety. They're used as anxiolytics because of their action on the limbic system. They're used as anticonvulsants. Diazepam and lorazepam are life-saving drugs in threatening conditions such as seizures in status epilepticus, tetanus, drug-induced convulsions, febrile convulsions, and clonazepam is used in absence seizures. So they are DOC and anticonvulsants. Muscle relaxants. They reduce the skeletal muscle tone and they're particularly useful in conditions which cause spasm due to joint injury or sprain. Pre-anesthetic medication. These are the drugs which have sedative, amnesic, and anxiolytic property. So, because of their amnesic property, the patients cannot recall the preoperative events, and their anxiolytics and as well as sedatives. So this is why they're used as pre-anesthetics and also in minor procedures like endoscopy, fracture reduction, and cardiac catheterization. They're also used in alcohol withdrawal and psychiatry. The adverse effects, although they're generally well tolerated, there is drowsiness, confusion, amnesia, lethargy, weakness, headache, blurred vision, ataxia, impaired motor coordination. There may also be paradoxical irritability in some patients and anxiety and convulsions. Apart from barbiturates and benzodiazepines, we have Z-hypnotics, which includes zolpidem. Now, zolpidem is a hypnotic drug for short-term treatment of insomnia, which has minimal tolerance and minimal rebound insomnia. So it's a good hypnotic with a weak anticonvulsant and a weak muscle relaxant property. The dose has to be adjusted in hepatic dysfunction and old age. As I told you, benzodiazepine antagonist Flumazenil. Flumazenil competitively reverses the effects of both benzodiazepine agonists, which cause CNS depression, and inverse agonists, which cause CNS excitation, given IV rapid onset of action. So they have a short half-life, which is why they're given IV, and they have a rapid onset of action. They reverse benzodiazepine sedation, anesthesia, and overdose. With this, we have discussed all the sedative hypnotics, and here's a quick recap. Sedative hypnotics. Sedatives are drugs with calming, quieting, and reduction in excitement property, and hypnotics are drugs that induce sleep resembling natural sleep. In sedative hypnotics, we have benzodiazepine, barbiturates, and miscellaneous drugs. Non-benzodiazepines such as buspirone, zolpidem, and benzodiazepines increase the frequency of chloride channel opening, and barbiturates prolong the duration of chloride channel opening, and both cause hyperpolarization of the neural membrane and lead to facilitation of inhibitory neurotransmission. Thank you so much for watching, and please stay tuned for more. Thank you.